Hello and welcome in. They call me Sour, and we are watching The Pit. We are on episode 2, season 2 of The Pit. And episode 1 immediately threw us into a different world, shall we say. It is The Pit. It is familiar. We see some of the same old faces, a couple new, but everything about the energy has changed. I think that was one of the things I noticed the most was how much, even between like Dana and Mel, the energy has just shifted a little bit. It's been 10 months since Langdon was working, and you can tell that I don't know if it was his presence necessarily, but 10 months of Javardi and Whitaker and Santos and Mel has changed the energy of the pit. And 10 months without Langdon. I'm really excited to see 8 a.m. So, if you'll join me, let's get started. We're starting right where we left off.
Trauma's at the back door.
Ooh, what's going on with the baby, though?
Let me know when the rest of her labs are back.
Oh, she seems really, not
The
okay.
girlfriend hasn't been much. Apparently, she's only been going out with the little girl, Kylie's father, for a few months.
Where's he now?
She's in.
I have no suspicion of the girlfriend, which is maybe a mistake, but it seemed like she's only been dating the dad for a couple months, and the breaks went back a couple years, or at least a year. I think it's going to be exposed that the little girl is being abused. I think the girlfriend is going to freak the fuck out.
You're right there.
How's our little girl?
I thought they agreed that each attending would only go to one of them so that there wasn't like a conflict. If Santos already talked to Robby, why talk to the lady whose name I can't remember?
It's this thing that AI will never have.
Nah.
I don't want to
Amen.
think about what my gut is saying right now.
Come find me when you.
My closed caption is not on. That's kind of rude. Sorry about that.
Do you want to jump on?
Us. I'm so confused.
I don't want this one getting away from me.
We don't know what this is yet. Don't go jumping to conclusions.
I'm not jumping to anything. I'm just looking out for my patient. 58-year-old guy, triple scaphoid fracture, epistaxis, non-focal neuro, bitchnized head trauma.
I still think he has a neurological issue, and that caused the fall.
You want to jump on this trauma in the meantime?
What is it?
It's a surprise.
Wonderful.
Ah, the best kind of prize is a surprise.
Mel, you want to jump on this?
What is it?
He's just
It's a
pulling
surprise.
everyone in.
What you got
I'm
for us, Sam boy?
Alan Billings,
confused.
pallet of roofing tiles fell 8
Oh,
feet
it's
his
that.
upper arm with an open
Yep.
dislocation.
Yep,
2 rounds
that's a
of
thing.
scent.
Ugh. Nope. Nope, nope, nope.
Oh, it really hurts.
Give us a minute.
Oh,
We're gonna take
God.
care of that, okay? Any headache? Chest or belly pain?
Yeah, that would really hurt.
99, pulse
What do you think, Dr. King?
It is an open dislocation.
Can you be more specific?
I
No.
think it's inferior, yeah?
Do you remember the name for that?
Very bluntly, this is what it is. Can you be more specific? No.
Sir, can you feel me touching you? Okay. Can you wiggle your fingers?
Oh, God.
Hey, what's next? Dr. King?
Yay.
Ancef and gentamicin, sedate for traction, countertraction.
Yeah, can we please put him out?
To rule out vascular injury.
That sounds like a plan.
But with an open joint, he needs a washout in the OR with ortho.
Agreed.
Let's get an opinion from ortho. Is that new Dr. Wishful thinking?
Ortho like to take
Yeah.
their sweet time.
It obviously could be bias. We all, as far as I'm aware, love Dr. Robby. But at the same time, it feels like she's being combative when she doesn't need to be. I don't know. It could be bias. But also she really has a problem with personal space, and this is the second episode, and it's like the third or fourth time that she was all up in his bubble. Ugh.
How's your day going, Doc?
Yeah, pretty good.
Oh,
Medical students Ogilvy and Kwan are going to be working with
You
you.
want them
Hello.
to try it? They gotta learn sometime.
It's best if they watch the first one.
I can prep and drape.
Yeah.
He's so willing to help.
Anticipate more than 5 liters.
Oh,
And last time it was 6.
It's like a gallon and a half.
there you go.
High octane premium.
Okay, you need anything else, Mr. Louie?
No, Mr. Louie.
No, her husband died?
Not till you tell him.
I'll be right there.
Dana, don't make me laugh about. Don't make me laugh about that.
I can't see. I can't see anything.
It's because your eye is shut.
I can't open it. It's glued shut. I was trying to put on lashes. Oh
Oh,
my God.
it's
Oh my God, am I gonna
okay.
go blind?
No,
No.
I'm pretty sure this is something we can fix. Just take a deep breath.
Yeah.
Glued your eyes shut with what exactly?
Super glue?
Okay,
What?
is it
Why?
something you typically use to apply your lashes?
No, it's typically something you use to glue shit. You break like coffee mugs and stuff. You know what I'm talking about. It's super glue.
Okay, okay.
Yeah. Why would you use
Can I just
super
talk
glue
about
on your
the
lashes?
She'll know what to do. Works here in the
Dr.
ER.
J.
Yeah, I don't...
Who's Dr. J?
For a Z-track,
Javardi?
we pull up the skin before advancing into the peritoneal space.
Ooh. Oh, it looked like a
good.
spinal tap for a second.
Fluid's clear.
Is that hurt as much as
Yay.
it looks?
Oh, it's not too bad.
Doing one on these
Feels so
fluids.
bad
Cell
for
count to
him.
rule out spontaneous bacterial peritonitis. Ding. What would make that diagnosis, Joy?
How are we doing in here?
They are doing great. I think they got this.
It feels like she's Robby's shadow. Like, stop it.
Yeah, what else you need? How about a double espresso martini? Like the way you think.
Oh, Santos and
pretty
Dana,
thing.
two of
What's
my
going on up there?
favorites.
What's up, Crash? You mean besides my mother driving me insane?
Yep, besides
I know
that.
that her efforts would be better suited to endorsing someone like myself. Let me save you the trouble. You can't do it.
No,
Why? Just because you couldn't do it?
don't.
Honestly, yes.
Ugh.
Because you're a genius. Yes. Social worker Dylan Easton is covering for Kiara this weekend. They're on their way down. Thank you.
Okay. So Mel is obviously a representation of most likely a low support needs, autistic. There are moments where I question that about Santos as well, because she reacts so much like a PDAer. You say, I can't, let me prove you that I can. And that just made me smile.
Oh, shit.
Uh-oh.
I have a nun with conjunctivitis. Her swab is showing gram-negative intracellular diplococci.
Ooh.
Maria? Come to Jesus. Well,
Santos.
Lab must have made a mistake. Maybe it's an immaculate infection. We'll call the lab to clear this up. Tread carefully, Missy. There's a nun with gonorrhea in her eye.
Santos, stop it.
Seriously, you guys are gonna take this away from me?
No.
Just point it at you two.
I love her so much.
Used a
Yeah.
cast saw before? Of course you haven't. Well, today's your lucky day. Follow me. Dr. Mohan, you got a minute?
Yeah.
Have you
Aww.
met Emma? First day, new grad RM?
Hi.
Nice to meet you.
Emma needs to learn cast removal.
How long's the cast been on?
Months, maybe years. Probably gonna want to breathe through your mouth.
No, put a mask on first.
Mr. Digby, Dr. Mohan can cut your cast off now.
Aww.
How long's the cast been on?
I don't know, but it's really getting itchy.
Oh, there's gonna be
Hey,
something
this
gross
cuts the
under
cast,
it.
not the stem.
I want to know how it does that, though. Yep. I have a feeling it's gonna be bugs or really bad infection. I'm scared.
Thank you.
That's not a good sound. Oh,
Oh, I see you brought some friends.
Yep.
Oh my God, are those? Maggots.
yep. No. I feel so bad for him.
Right?
Yep. Go throw up. Oh, did we need to get a second? Did we need to get a second look? That's. I can watch blood. I can watch guts. I have a little bit of trouble with eye stuff, as we learned last week, or as you all learned. Maggots are a hard no. That's just a no. I knew it was going to be something like that, but I didn't want to see it, and not twice. Oh, okay.
Okay, on my count. 1.
Did they put him to
2,
sleep?
Come on, motherfucker.
Yep.
Humor head is not reducing.
Should be done in the OR.
I am the OR.
Okay, we're gonna get this back in before Ortho even answers the page. Mel, stick 4 fingers under that humeral.
Oh,
head.
really?
Yeah, get in there really, really deep. And when you feel the traction, and lift it above the glenoid, that will convert this to an anterior dislocation and should pop right back in.
Mm-hmm. Obviously, not nearly to this extent by any means, but I have EDS. I have subluxed, like, had the joint pop out of place many times. That is painful. I cannot imagine what the body is saying right here. Even though he's passed out, I cannot imagine the amount of pain that this is communicating to the body because holy crap.
Ready to go?
1, 2, 3.
Yo, there you go.
Very cool.
There you go.
Shoulder immobilizer and CT. Guess you guys don't need me anymore.
Oh, Mel, why is she
right,
so...
Dr. King?
Oh, right.
Yeah.
The,
Well, my deposition is today.
malpractice suit.
Do you want to talk about it?
I'm not allowed to.
No, we don't have to.
Okay, A, I love Mel. Robby, do you want to talk about it? Mel, I'm not allowed to. Like, duh, I love her so much. Second of all, her little look towards Dr. Lady. I can't remember her name, so we're just going to say Dr. Lady until I catch it again. It felt so much like when you need to talk to a boss or a teacher or something and someone else is just encroaching in the conversation. Like, yeah, she has every right to be there, but Mel doesn't know her. She's not comfortable with her. That's not her boss. The uncomfortable look was very sweet and cute.
To talk about the deposition, but we can talk about how it is affecting you.
Yes.
Average emergency physician catches a med mal case every 7 years. 9 times out of 10, the doctor wins. I've been sued 4 times myself. Dr. Al?
I've never been named in a lawsuit.
You also have not worked the ER outside of the VA,
Sometime.
as far as we know. Oh, that was not helpful.
I wish we could recruit as dedicated and talented young women as you two.
I imagine it's a calling, much like medicine.
Yes, very much so. Is that serious?
It can be, if left
Yeah.
untreated.
How did I get it?
Tell her what it is.
So it's gonorrhea. Traditionally, that's the sexually
I
transmitted.
know what gonorrhea is, Dr. Savati. I'm a nun,
She's-
not a numbskull.
Yeah, she's a
I
grown-ass
do a lot
woman.
of work at an unhoused shelter.
Are you handling dirty sheets, pillowcases, soiled
Yeah.
clothes? Wear gloves?
When they're available.
Okay.
Well, let's get you your shot and set up for irrigating your eye. I bet we can scrounge up a couple boxes of gloves while you're here. It's important to
She's
protect
so
yourself.
incredibly kind.
We'll be back.
I'm not sick.
Oh, we took care of your husband, Ethan, earlier today.
Is Ethan sick?
Not
He
anymore.
was very ill. I'm so sorry to say that he died.
Whitaker.
Died? No.
Yeah,
Are you sure?
he's sure.
Yes. I know how difficult this must be for you.
Oh my goodness. Is she gonna start laughing? Oh, that was sad. Whitaker has such kindness and respect for people that it feels appropriate for him to deliver such news. And I know it's appropriate because he was the doctor, but my heart aches for her. And the fact that, I don't know, the fact that they paused when she said, "Are you sure?" There's a part of me that's like, what if it wasn't really Ethan? What if it's some other old guy at the at the place and it wasn't him. But she also seems to be having cognitive difficulties, and so maybe he's been sick and she can't remember. Either way, that's incredibly sad.
Hi, Dylan.
Robby.
Is this the tumble down the stairs kid, Kylie?
Yeah.
And?
I'd like to talk to the girlfriend first.
I like that we're getting to see different people in the same positions because that's how like a hospital or medical clinic actually works. There normally isn't one person doing everything. So it's nice to see another social worker.
More labs are back on our abandoned baby Jane Doe. Everything looks normal.
I'm going to need her to stop. She is going to piss me off. To pull the tablet basically out of Robbie's hands It kind of feels like she's marking her territory, and I don't like it.
You seemed really concerned earlier.
Yeah.
She still needs a catheter in.
Or not.
Yeah. Can we
You
not?
can't trust a bagged urine.
Agreed, but we can avoid the trauma of a catheter.
Yeah,
With a
please.
suprapubic tap?
Oh, I may have a trick or two up my sleeve, Dr. Alashimi.
Al-Hashimi. Al-Hashimi.
Thought you forgot about me.
No.
Oh, no, it's just with other patients. So, what do you do for fun?
I mainly do what my sister likes.
No, what about you?
Oh.
What do you like to do?
He finds her attractive. He wants to know about her.
You still like the Renaissance Fair?
Really?
Yeah.
Isn't that kind of dorky, though, where everything's
Aw,
supposed to look like somebody they're not?
damn it.
Yeah, but that's the fun, you know? You can be anyone or anything you want.
No, I liked him. Felt something was off, but I did like him. But if the very first thing she says about herself, he is negative about, I'm watching you. I don't like it. I went from so excited to like older sister type vibes. Protector.
That was the 17th century French
Oh,
woman.
oh. Oh! Oh my god, is Mel okay? What? They showed her head really close up. Did she have a clip in? Like in her hair? Because I know you're not supposed to drive with those because if your head goes back, oh, Mel.
You okay, kid? It was a doozy.
Okay, we
Oh,
ready?
I really hope she's okay.
Cleaned and dried with sterile gauze.
Is that water cold?
Right out the fridge.
Okay, Jesse, you can take the armpits. So I'm gonna take the legs.
I'm betting Dr. Robby always has a trick up his sleeve.
There we go. Looks like you got a good midstream sample.
Yay!
Here's a fresh blanket.
Okay, next steps.
Foster care?
Someone must have been in a bad way to walk away from you, little one.
Oh,
We need to call the police?
Dr. Robby with a baby in his arms is just like ovaries, bam, 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 bam. Because the gentleness and the care and slight comfort at which he picked that baby up was so sweet.
We will let you know what the urine
Oh.
shows.
Oh, what's that? Just some spit up or something going on?
You must be Dr. Langdon. I've heard all about you.
Oh,
Welcome back. I'm Dr. Al-Hashimi.
Nice to meet you.
Nice to meet you. Okay, if some of our trainees join me.
Not a problem.
I
Dr.
have
Langdon, you are more than welcome to stay too.
so many
Ready for a minute?
questions.
We're pretty busy in triage.
Okay. It's protected, confidential, doesn't even stay on my phone.
I do not like that.
Trauma, no LOC.
Okay, you need to get checked out.
Fine.
No.
Choice, it's work related. Prep for a burr hole?
What?
Oh.
Oh. I forgot how much you like to joke. Captain Scurvy.
Who the hell's Captain Scurvy?
Lay that order, sailor.
I appreciate the worry and care from Langdon towards Mel. I think it's really important for both of them. I don't know how to put this. I don't know if I trust him with her. And what I mean by that is I don't trust him not to accidentally hurt her. For the patient that was hitting on Mel, obviously being chased by the cops does not automatically make you guilty or anything like that. But the way he ran and did not care about Mel, and then was he attempting to nag her? Like, I'm glad he's gone. Get gone. Why is everyone calling people seafaring names?
Dr. Rabinovich?
There's
Okay.
his- You can call me Robby.
You can call me
Oh,
Noel.
flirty. Flirty.
Oh, you could just tell me what the hell's going on here. This is just a simple insurance transfer. Yeah, okay.
Yeah. McKay has, oh, I remembered her name. I remembered her name, unless they just said it before this, which is possible. But last episode, I could not remember her name for the life of me.
She has a very heightened sense of empathy,
Meaning?
meaning she's good at picking up on stuff.
Yep. You
Didn't
two
see
are,
anything, did you?
Nope.
don't like
I
it.
subscribe to the Falstaff advice. Discretion is the better part of valor.
I don't know how I feel about that.
Stinks.
Oh,
Evans.
Dana.
Hope you know what you're doing.
Thank
What
you,
is that
Dana.
supposed to mean? I'm a big girl. Okay, big girl.
If Dana looked at me like that, my life would like stop. Oh my goodness.
Headache?
No.
I can get you some Tylenol unless you need something stronger.
Oh, no, that's okay. I'm not very drug tolerant.
Lucky you.
Yeah.
You know, I'm glad you're back.
Oh,
Thanks. Yeah, I'm glad to be back.
I appreciate that.
You know why I was
See my
gone?
patient? No, not really. I mean, I heard rumors, but I learned a long time ago not to listen.
I was in rehab
Oh?
for an
Oh,
addiction to benzos.
Oh.
he is being so forthcoming with her.
But I'm clean now, and it never affected my work. I'm sorry, Mel.
You never let me down.
Yeah. Yeah, I did.
Yeah.
Hey,
I
how you doing?
I am very emotional. I will start to cry at tension. I appreciate Mhm. I appreciate the fact that he recognizes that he let so many people down. And more than that, I appreciate the fact that he recognizes he let Mel down. He kind of phrased it in a he let everyone down way, which whatever, but he did let Mel down. And I appreciate that they were able to have this moment. I wish she hadn't hit her head to get this moment, but I really appreciate it.
So I'm really sorry about all of that.
It's worth a
If we
look.
do find him, you may have to testify in court, Dr. King.
Yeah, but we'll cross that bridge when we come to it, right?
Yeah, protect
Mel?
her. She's
Rest
gonna
here a
have a
minute. I'll be right back.
meltdown. She's gonna have a meltdown.
Please. Doctor's orders.
ER can be a little bright and noisy.
Stop. Because she taught him that. She taught him that with the autistic patient last season. Oh, fuck you, Langdon.
I mean, what do you think of the
I
app?
don't
I mean, it's
like
hard to
it.
say without seeing the full thing.
Take a look.
Do you know how much time this will save?
Studies show you can spend 80% less time charging.
Oh, the look of death
Get
she
out of here
just gave
sooner,
him.
improving.
It says here she takes Risperdal, an antipsychotic. She takes Restoril when needed for sleep. So is that,
AI. Almost intelligent.
Yep.
You must always carefully proofread and correct the minor errors. It's excellent, but not perfect.
That's not minor, though.
Machakara.
خواهش میکنم شما فارسی بلدی? You speak Farsi?
Enough to break the ice.
I am impressed.
Flirty. Not necessarily
Me too.
with her,
Bet
but
you had friends.
Dr. Whitaker, I said hello to your widow with Alzheimer's, but she only wants to talk to a doctor. She's also very overdue for a diaper change.
oh,
Thank you. Mrs. Bostic?
Hello?
Hey. You wanted to see me?
Who are you?
oh, yeah.
Dr. Whitaker, we talked about your husband.
Don't tell her again.
Unfortunately, he was very sick, and he died.
It's not going to stay. Please stop trying to tell her after this. They need someone, maybe from neurology or psychiatry, because she is not going to retain that information at this point. And if they keep telling her, it's going to do nothing but wear them down and give her stress over and over again. They need, does she have a care team? Does she have family? That should be the last time they tell her without talking to someone who has experience with either dementia or Alzheimer's, because she's not going to retain it. Oh my goodness.
Nice and clear.
Kid knows his shit.
He's so smart.
She is sick of his shit.
He's
Yeah.
obnoxious.
Well, what he is your competition. He's a gunner.
Yeah, right.
Yeah. Right.
You don't think he's angling for an emergency residency spot here next year?
Mm-hmm.
I mean, even if he was,
What? He couldn't possibly compete with your gigantic brain?
Does Santos have a problem with Javardi's ego because Santos has such a big ego? Is that what's going on there? Or like, because you can definitely feel the love in their interactions. You can definitely feel that there is a camaraderie, there is a connection. But it seems like in this episode, not so much in the last, she's very annoyed at Gervardi for, I don't know, being young, being competent. I don't know. I am interested to see if Langdon apologizes to Santos because she knew. She knew. She spotted it. Will he thank her? Maybe he should thank her. Because without her, who knows where he would be now? What mistakes he could have made.
Friends don't give each other shitty nicknames.
You think Huckleberry's a shitty nickname?
Oh.
No. Huckleberry's cute.
Oh, Gervardi.
It's cool. It's not like Crash.
You're so
Come
bad.
on, man, Crash is pretty cool. It's like, Crash.
Okay, I will be in exile on Triage Island and with the rest of the drug addicts if anyone needs me.
That perfectly shows the awkwardness I was talking about earlier because, like, Whitaker and Gervardi, not awkward. Just casual friendship, camaraderie. I'm using camaraderie a lot. But normalness, normalcy. That's the word. And then Langdon walks up and it's just like whoosh, awkward, uncomfortable. Everybody feels out of place. Something has shifted the energy.
It was weird.
It's very.
Saan yung party ni Javadi?
Wala pa yatang plano. Mukha bang 21 si Javadi sa'yo?
Ngayon, oo naman. Napakaganda itong lugar na to.
Ay, ano ka?
Hindi ikaw.
Oh,
Hindi ako.
princess.
Pero yung ibang tao.
Oh, no.
Dr. Whitaker,
Oh.
your assessment was spot on. Your Alzheimer's widow definitely needs placement.
Do you have a nursing
Yeah.
home that can take her today?
But I do. She's gravely disabled. I'll put her on a psych hold. We'll make it work.
Thank you, Caleb.
Yeah, you have a few moments, Michael?
Actually, I do not, but once I get things settled here, I will come and find you.
Okay.
Everybody's being so awkward.
All right. I guess it's just us. What did the girlfriend have to say?
Well, Gina seems a little confused and on edge by this, but I'm not suspicious about abuse on her part.
What
Yeah.
about Kylie's father?
Well, I'm a social worker, not a mind reader. I need to speak with him.
This dude doesn't show up? Hell, I'll go find him myself.
Yep, and she will.
Kidding.
I
Nope.
will speak to Kylie before her dad gets here.
Abdomen is soft, non-tender.
How do you know it's non-tender?
Because I didn't see any grimacing.
He's altered. He didn't even
Yeah.
flinch for the IV start.
I meant to say non-rigid.
You can check in with Dr. McKay or Dr. Santos.
If you
Yeah.
don't mind, I'd like to observe, learn how you handle things.
Whoa, blood sugar's critical high, so over 500.
Ding, ding, ding,
Jesus.
ding, ding.
Sounds like diabetic ketoacidosis. We need to start treating that, then write to CT to rule out an intracranial bleed.
Yes.
This guy needs an insulin drip, right? 0.1 units per kilo?
No, not without knowing his potassium. Insulin
Oh.
causes an intracellular shift, and if the potassium is under 3.5, the drip would kill him.
That is very true. Why is he in decay?
Maybe he's not taking enough insulin.
More frequently, a precipitating event can be identified, such as pneumonia, urinary tract infection, stroke, myocardial infarction, pancreatitis.
Yeah, we always check for those. They're part of the standard order set. Right? Dr. Mohan?
Okay, I don't like the intern. That's fine. Santos got to Gervardi, and now it's a medical knowledge measuring contest. And my problem here with that right now is that does not provide the best care to the patient. They're not working together, they're competing. And no. Yeah.
I got something that needs attention.
Not another baby. Sorry, excuse me.
Wait, no, you're in the middle of a procedure.
This is Mr. Randall. He's been erect for the last 8 hours.
Should have gone
Oh
down.
my.
Right? Do you mind finishing up with the bakery since?
I'd rather not.
So, Mr. Randall.
Ian,
Ian, did
Ian.
you take anything that might have led to this condition?
I used an ED injection.
Ooh.
2, actually.
So, double the recommended dosage?
And you wonder why it's still there 8 hours later.
Is this a big one? The anniversary, is it important, like significant, like a milestone, or?
It's our 20th.
Oh, nice. Well done. Congratulations.
Oh.
We can start the insulin drip and add 20 of K to each liter.
big anion gap of 24. It should be under 10. We follow it to assess progress.
Actually, the 2024 International Guidelines state that anion gap should not be used as they can be misleading in the presence of hyperchloremic metabolic acidosis. I recently had a case in the ICU.
What causes the acidemia?
Without insulin, the body can't use glucose, so it breaks down fat-producing ketones, leading to severe acidosis, which can cause cardiac arrest.
But the hyperglycemia causes the body to excrete more water and electrolytes, leading to severe dehydration, cardiac and renal dysfunction.
Robby's sounding
drip,
fun.
fluids with KCl, capillary glucose every hour, Chem 7 every 4 hours.
ICU's gonna want a double lumen midline too.
I can do it.
7.5 Club.
Can I just say we evaluate our students not only on their fund of knowledge and on their procedural mastery, but also maybe more importantly on their skills as team players?
Yep, thank you.
He can do it.
She can do it.
Uh-huh, sure.
Otero, will you update everyone?
Barry Mitchell, eating breakfast at Pamela's, sudden onset respiratory distress.
Oh, no.
Some Strider, decent pulse ox but trouble speaking.
And they tried the Heimlich?
3 times.
You can hear his
Any history of asthma?
trouble breathing.
Draw ketamine and rocuronium.
What about ketamine only?
Well, we need full paralysis for a successful first pass intubation.
Might not need an intubation if it's just a foreboding.
We can't assume that.
I got ketamine and rock.
Ketamine only, 80 milligrams.
In that case, I'll leave this in your capable hands.
Thank you.
30 minutes ago, I told you I'd never been sued. I'd like to keep it that way.
It would be great if everyone could be a team player. But maybe that's like a huge part of the friction that we're noticing in this episode is that all these people who we ended on them being such a great team are now all disjointed and having a hard time. And obviously, we're supposed to see I'm going to say Dr. Al, as a threat. Like, we're supposed to not like her to a degree. It's succeeding. I do not like her. Why is she acting this way? Why is the blonde dude acting that way? The intern. We know why Javardi's acting that way. We get why Robby is acting. I want to know why.
Stir a bowl of saline. You might need to refill since they'll be flushing over and over again. Hold out the empty basin to catch whatever they pull out. Got it?
I think so.
Holler if you need me.
Dana teaching this episode or this season like fills me with such joy. I can't get over. Last season we saw Langdon, we saw McKay to a degree, but we saw Robby teaching so much constantly. And this season we've seen Whitaker teach, we're seeing Dana teach. It makes me really happy that in all the awkwardness and chaos and whatnot, we're also seeing them grow and bloom and change. Dana is so comfortable in everything she does, or at least she gives that air. I just love it.
Did a lidocaine block to the dorsal penile nerves at 10 and 2.
Yeah, he's ready.
All right.
And
There's
to
a
the
penis.
dorsal side to hit the corpus cavernosum. I'll hold the glands.
How deep? 2 centimeters. Now aspirate.
Okay. Ooh.
You
A lot of
guys
blood.
do this like every day?
Not every day.
If we're lucky.
Oh, there's some kind of joy in that, though.
Good view of the epiglottis.
I think he breathed in whatever. Oh, okay. Never
This is
mind.
what you.
Oh, you got it?
I can see why the Heimlich didn't work.
Rotate a little bit.
Ooh.
Voila. That is why you give ketamine alone. Because if we gave a paralytic, we would have to intubate and ventilate for an hour.
I'm nodding like I knew that. I didn't know that. But I am just agreeing with him that, like, I think that's part of the problem I have with Dr. Al, is she wants to go full force, full throttle. And Robby seems to take the approach of do what you have to as long as you can, and then add on more. And a part of me is like, why did he have to make that comment? Because, right, him and Dr. Al are here. And then you have like McKay and I don't know if Langdon is still there anymore, but then Whitaker. And then you have the interns and so like don't think he's pulling them into drama, but that was my gut reaction, like my knee-jerk reaction. He's trying to inform them why he chose to do things the way he did.
I feel like they're just trying to keep her down here.
Can you blame them? Never met a Pete's nurse yet that wasn't a little wacky. You know what 12 hours of crying babies does to a person's psyche?
I almost went into Pete's.
Good thing you didn't trust me too long up there, you cuckoo for Cocoa Puffs.
You are very punchy today.
Punchy's my new baseline.
Seriously?
No one even looks at me funny, I'm taking him out. Going right for the eyes. Well, I got you. But you never knew that about me.
Dana needs to stop being so attractive. Can she just stop?
Better her than me. I did not intend for that to come off as sexual in any way. And on that note, I'm gonna go check on Louie, and then I'm gonna get some air in the ambulance bay, so if anybody needs me, that's where I'll be.
Water cap.
How we doing in here?
Good. Almost 4 liters out.
Jeez.
Already feel like $1 billion.
We're gonna lose him this season. So much
How
blood.
long does this take?
Up to an hour, sometimes 2. Mel, you did these at the VA. How can we facilitate detumescence?
Oh, sometimes massaging the shafts can help.
That's what she said.
I love Santos.
You okay, Mel?
She's thinking about her deposition.
I also know your work, Dr. King. Your medical decision-making in the chart is always extremely thorough.
Yeah, we're getting somewhere. First signs of flaccidity.
Yay!
I don't know how I could ever thank you.
Well, I think you just did.
You saved my life.
I didn't do anything.
No, her.
She's got me keeping a food journal.
It's a good way to count calories.
What calories? She insists I eat 5 servings of vegetables a day. A rabbit don't even eat that many vegetables. I ain't never choked on a sausage egg McMuffin.
Well, where are we going now?
Don't.
I thought you might like to see your husband.
Yes, yes, please.
I don't like this storyline. He's dead, honey.
Oh, this has been such a long day. I'm so glad to see you resting. If we stop at the store on the way, I can...
He's gone.
Make your shepherd's pie. But not if it's hot out. You know how I hate using the oven in the heat.
Does he think that this is going to help her remember? Because I don't think it is.
Dr. Robby, is this a good time?
No.
Depends on what you have in mind, Dr. Alashimi.
Go away.
I'd hoped you would have reviewed my ideas for improving the department.
When?
I was looking forward to getting some feedback from you. Let's take generative AI, for instance.
No.
ER doctors spend 40% of their time charting, only 28% of their time at the bedside.
That doesn't sound accurate.
I've included the study in my packet.
What do you got? Combative college kid. Flipped down the library, tased in the neck by campus security, 5 midazolam to...
Wow.
It's 2901! 2901, motherfucker! Get up! Fuck you!
Tell me some more about your ideas.
Let me the fuck out! Let me out! Let me out!
Okay. I think I have a lot less to say than last episode, but let's see how this goes. All I can think about is the widow. I don't like this storyline. I don't like that it feels like they are, in a way, torturing her. Okay, what else? A lot of the, patients that were pretty much probably only going to be in this episode or are in the episode for next episode for a few minutes. No real thoughts. The guy choking on the broccoli, the bacon splatter issue, the erection. All of those are fine. No real thoughts. I am a fan of progress. I am a fan of improving things. I do not believe that just because something has always been done one way, that means it always must be done that way. At the same time, Robby is very protective of the Pitt. And I think that patient passports, good idea. Gen AI in a medical setting. Gen AI, first of all, you. In another world, it would be great. But we do not live in a world where generative AI is currently anything but destruction for our planet. And yes, it being used in a medical setting is the ideal setting. I do not think we are at the point where Gen AI should be used with patients. I don't think we should normalize it, and I don't think it is currently reliable enough to use when dealing with patients. I don't mind the patient passport thing as someone who's regularly been a patient in my life. That wouldn't be a bad thing to have. I find it weird that it's like an actual little laminated thing. That seems like something that should be in an app or the website. I understand both her want to improve and Robby's reluctance to change. There's certain things that if they work, if it ain't broke, don't fix it. And then there are certain things where it's like, okay, how can we make this better? I will say that she did want to collaborate and he's kind of digging his heels in. Her being more corporate, agreeing with Gloria, is going to put Robby on alert. It's complicated. I don't know. Overall, this was a really frustrating episode for me. Like, I am ending this episode with a lot of frustration and annoyance. There were a lot of things that the intern and Javardi going back and forth irritates me to no end. I did clock that social worker with the red hair undercut clocked Santos for who she is. I love Santos. Genuinely, she's probably one of my favorite characters. But she also is willing to take things into her own hands that probably shouldn't be. This sounds really bad to say, possibly, but I don't really care about the baby situation. I'm sorry. I don't. Dana is amazing this season. She was amazing last season. I need to find the actress in other things because she just blows me away. I'm kind of ending this feeling frustrated and not sure why certain people are acting the way they are. As you saw, I did almost cry when Langdon turned off the lights and shut the door for Mel. It was a good episode. I don't think there's been a bad episode of The Pit yet, and I don't expect there to be one. And also, I'm kind of like, I want to watch the next episode. So this frustration doesn't stick. I don't remember an episode last season that made me feel frustrated or disgruntled. And that's how I feel right now. So, anyways, thank you for spending this time with me today. If you did enjoy our time together, if you could like, subscribe, hit the little bell icon, I would greatly appreciate it. And I look forward to seeing you next time. Thank you so much and have a wonderful day. Bye.